Hey guys, here's another test question. This is on Hipaa laws. This is actually an ATI NCLEX-style test question. Which information regarding Hipaa laws requires further teaching? So this type of question, you have to be careful about the stem of the question and what is the question asking you. The question is asking you to read through the answer choices to figure out which one of these answer choices requires further teaching, which means you're looking for an answer that does not reflect Hipaa laws. Okay, so let's get started. Number one, information about a client can be disclosed to family members at any time. Number two, Hipaa established regulations of individually identifiable health information in verbal, electronic, or written form. Number three, a client's address would be an example of personally identifiable information. And number four, Hipaa is a federal law, not a state law. All right, so I'll give you a second to think about what you may think is the answer, and we'll go over the answer choices and the rationales. Let me take a second to share with you that I'm back in town. I was out of the country for a couple of weeks enjoying our wonderful trip to Italy, but now I'm back and I'm sharing content, so watch out for my videos on YouTube, Nursing with Hart, PhD. I'm on TikTok, Instagram, Facebook. All right, so we're back to this test question, and the correct answer is number one. So we're looking for the answer that doesn't look right, the answer that doesn't reflect Hipaa laws. Okay, so the information about a client cannot be disclosed to family members at any time. Okay, when you're reading this test questions about Hipaa laws specifically, try not to assume that there is a consent. Okay, assume that there is no consent. With no consent, the information cannot be about the client, cannot be disclosed to family members. Okay, so number one is the correct answer that you're looking for here that requires further teaching. Now, let's look at the other answer choices. Number two, Hipaa established regulations of individually identifiable health information in verbal, electronic, or written form. And that one is not correct because this statement does reflect an understanding of Hipaa. Healthcare organizations use electronic transactions that code sets, such as healthcare claims and claim payments, must comply with Hipaa standards. Number three, a client's address would be an example of personally identifiable information. Okay, that statement does reflect an understanding of Hipaa law, so that's not the correct answer. We're looking for something that requires further teaching. Identifiers for information include the client's name, address, phone number, driver's license, and so on. Number four, Hipaa is a federal law, not a state law, and that is a true answer. So that does reflect an understanding of Hipaa, which is a federal law that was passed in 1996. Okay, and so that's it for this test question. We'll see you on the next one. Have a great day.